Pathophysiology of thrombotic stroke. A stroke is defined by the World Health Organization as a rapidly developing disease of the cerebral vasculature that involves focal or global loss of cerebral function for more than 24 hours. It may be categorized as ischemic or hemorrhagic. An ischemic stroke occurs when there is sudden occluded blood flow in arteries supplying the brain, which results in death of brain cells as they do not receive adequate oxygen supply. This process is called infarction. A thrombotic stroke is a type of ischemic stroke in which infarction occurs due to the formation of a thrombus or clot in the artery which blocks the vessel. This can occur in major blood vessels such as the carotid and middle cerebral arteries, as well as smaller intracranial vessels. The exact pathophysiology of thrombotic stroke is unclear. However, it is commonly viewed as a result of other processes that cause arterial wall abnormalities, such as atherosclerosis, arteritis, and hypertension. Atherosclerosis is considered the leading cause of thrombotic stroke. Due to an inflammatory response, circulating lipids are ingested by foam cells, which accumulate in the inner layer of the vessel walls, forming atheroma. As more plaque builds up, the intima thickens and the vessel gradually narrows. This creates turbulent blood flow, during which plaque ulceration can rupture and develop into thrombi. If the thrombus does not dissipate, it can prevent the passage of blood through the brain, leading to metabolic acidosis, ionic imbalance, and excitotoxicity in brain tissue, which causes an infarct. The severity of this is dependent on the circulation of connecting vessel branches and the size and location of the occluded vessel. In patients with severe atherosclerosis or conditions such as hypertension, the amount of collateral circulation is limited due to thickened intima. In small arteries, stroke symptoms may be motor or sensory deficits, whereas large artery occlusion can present with various abnormalities as different regions of the brain are serviced by different vessels. Following occlusion, if intervention is delayed by more than a few hours, the recovery outcomes continue to worsen for the patient, so treatment should be sought immediately.